Hi, my name is Katie.
And my name is Chris.
And we're the Dandrow family from Watertown, New York. Our daughter, Kristie, is 17 months old, and she was here at Samaritan. She woke up in the morning with croup. I put her in the bathroom with the hot shower running for the steam to break it up, and that just wasn't working. About 3 o'clock, we decided we were going to take her to the emergency room. Chris stayed home with our other 2 children, and I took Kristie to the ER. When we got there, we were seen very quickly. She was having retractions. They educated me on what retractions were because I had never heard the word before. Kristie was in pretty bad shape. They immediately started nebulizers and steroids. I was never left in the room alone for a long time. Then they decided we were going to be admitted. Once it got to be the morning, they were thinking about transferring us just to a higher level of care because she just wasn't responding to the steroids and nebulizers. The respiratory therapist came in for another nebulizer treatment. When she was walking out the door, we both noted that Kristie was having increased trouble breathing.
I'm Abby. I've been a nurse for about 2 years. I was Kristie's nurse that morning, so we started the morning off like we always do. We did a report and huddle, we got all the information, and I was told that we needed to watch Kristie pretty closely because she was really having a hard time. Was in there from 7:20 until she coded at 8:26. At that point, she had stopped breathing and her heart rate had gone pretty low.
I had never seen CPR being done in my entire life on somebody, especially to see it being done on my 16-month-old. It was awful.
When I decided that we needed to call the code, we pressed the button and it activated all the people that needed to start coming toward us. And you kind of switch into a different mode. The way that staffing was that day, myself and Scott had to be with her the whole time because she was so critical and so sick.
My name is Scott Sadler. I'm a nursing supervisor here at Samaritan Medical Center. My background is 24 years of pediatric ICU, neonatal ICU, adult ICU and EDs, and flying pediatric and neonatal patient transport. I was in my office. We just finished a morning safety meeting, and there was a call overhead for a code, and the room number was Kristie's room. It was determined that she needed to be intubated, and they intubated. Kristie maintained her saturations, her oxygen levels, and did not become bradycardic, both good signs through intubation. Intubation did take a while because her airway was almost closed.
My name's Courtney. I am the Director of Women's and Children's here at Samaritan Medical Center. I was here the day that we responded to Kristie's code. I immediately honed in on Kristie's mom, Katie, and knowing that I needed to give her support as a parent, I knew that's what my job was that day.
They got me out into the hall, and I was just a mess. They said, can we call somebody? I couldn't even call anybody because I didn't know what to tell them. I thought she was dying. They had called Chris for me.
I got the call and the nurse said that you need to get here now. When I turned the corner into the pediatric unit, my heart dropped because the first thing I saw was Katie sitting in a chair in the hallway crying, surrounded by people with a blue light flashing above the room.
We kept mom informed and dad informed the whole time.
The nurses from maternity and pediatrics, all of them came and were comforting me. I was never in the dark. They let me know every step of the way.
I just knew the team was going to pull through, and they did.
We waited for the helicopter. While we were waiting, I asked Scott and Abby about 500 times, is she gonna live? Is she gonna be okay?
It took some hours for them to get here, but they arrived. They flew to Rochester. They called us back saying how the flight went very well.
Jordan Sawyer, he went with the helicopter team to make sure she got on the helicopter okay, and Courtney and Abby walked with us. When we got to Strong, the team was amazed at the job that the nurses at Samaritan did. They couldn't believe that they got her intubated. They said her throat was severely swollen. We
got updates from them. We found that her airway, it was croup. She had a really, really bad 1 in thousands case of croup, and it worsened overnight. I felt very fortunate to be on that day. I was glad to be there to help with her. We have great teams here. Glad to be part of her care.
I firmly believe that Kristie would not be here today without all of the nurses here and all of the staff and the respiratory therapists, particularly Jordan, Abby, Courtney, and Scott, and all of the other nurses that just gave me comfort and emotional support. There were so many, I don't even know all their names.
Seeing Kristie today, it just makes me so happy to know that we can make such a difference. Samaritan doesn't always get to hear the good things. To know that this family was so thankful. She thanked me 1,000 times that day, and I told her, you do not have to thank us. You do not have to thank us. This is why we're here. To know how thankful they are is a really great feeling, and we are thankful for them for reaching out to us and wanting to do such an amazing tribute to Kristie. We don't always see the end results or the miracles that we do every day.
You can just tell that the nurses here care, and the respiratory therapists and everybody, they just really care about their patients and the patient's family.